Health literacy is an evolving concept sitting at the intersection of theories of health and education. It has the potential to make a great impact on the health and well-being of individuals, communities, and populations in the future. Much has been written on the links between poor educational outcomes, poverty, and poor health, and the convergence of these in disadvantaged communities. Health literacy is a concept that has the potential to address these issues through a multimodal approach that focuses on deep understandings, critical analysis, and empowerment of individuals and communities. Health literacy has been described and defined by many researchers, as a literature review by Sorensen in 2012 revealed. They found 17 different definitions and concepts of health literacy, from the narrow American Medical Association concept of assessing a patient's ability to navigate through and comply with the demands of the medical system, to broad-based and critical understandings that require complex and interrelated abilities in comprehension, analysis, communication, and advocacy. Sorensen and al. Define health literacy in the following way. Health literacy is linked to literacy and entails people's knowledge, motivation, and competencies to access, understand, and appraise and apply health information in order to make judgments and take decisions in everyday life concerning health care, disease prevention, and health promotion to maintain or improve quality of life during the life course. Health literacy can be divided into 3 levels or phases of learning, first described by Nutbeam in 2000. These stages describe the skills, knowledge, and competencies that are required by students at various points in their learning as they progress from a functional level through the interactive level and finally to the critical level of health literacy. It is important to note that a prerequisite skill for any student of health literacy is a sound basic ability in general reading, comprehension, and numeracy. Even the functional level of health literacy assumes some base level of skill with written text and numbers. This has implications for the universal application of health literacy in both primary schools and disadvantaged communities. The functional level. The functional level of health literacy is the beginning of Nutbeam's description and is the level most widely achieved currently in Australian schools. The functional level describes the most basic abilities of health literacy, such as the ability to understand health literature and nutrition guides, disease prevention information, and healthy lifestyle advice, and the ability to follow up medical advice in prescriptions and treatments. Functional literacy is concerned with the reception of information, and there is little interaction with the text. This level also contains the ability to interact with health professionals and the health system on a basic level, sufficient to comply with medical advice and navigate the medical system. The American Medical Association definitions of health literacy fall into Nutbeam's functional literacy level. Interactive level. The interactive health literacy builds on the skills gained at the functional level and moves the focus from the reception of knowledge to more advanced understandings and literary skills. Students at the interactive level of health literacy are able to combine their deeper understandings with social skills and their developing awareness of the social, economic, and environmental determinants of health to participate actively in everyday health activities and the community. They are able to assimilate new information and apply what they learn in changing circumstances and situations in life. Students at the interactive stage of health literacy are empowered to make decisions for themselves and interact with health professionals in more balanced and confident ways. Critical level. Critical health literacy is the highest level described by Nutbeam, although it could be more accurately described as an ongoing process and lifelong journey than as a level to be achieved by students in a HPE class. Individuals with sound critical literacy skills are able to use advanced cognitive and social skills to critically analyse health information, to make decisions for themselves and others, and to advocate for changes where necessary. Critically literate individuals understand the social constructions of power and advantage and are empowered to take action on social and political and economic platforms to enhance their own health and those of the community around them. Information and understandings gained through critical analysis of health literature and situations allow students at this level of understanding to make decisions and exert control over their life and their health, and to advocate positively for the health of others. The implementation of health literacy into schools-based HPE. The implementation of health literacy into schools-based HPE through its recent inclusion in the Australian curriculum reflects the understanding of the essential role schools play in health promotion and social development. Successive governments over time have sought to capitalise on this key role to achieve improvements in public health through the education of students in various health and preventative behaviours with varying success. Health literacy builds on the previous iterations of health education in schools, such as health promotion, by reflecting changing understandings of the importance of empowerment, self-efficacy, and socio-cultural factors in altering students' health behaviours. Schools. Benefits of implementing health literacy into schools. Schools are in many ways the ideal medium for the widespread dissemination of knowledge or new ways of understanding, given that in Australia we have at least 10 years of compulsory attendance, and most young people complete many more years than that. Schools have staff trained and specialised in the teaching and learning transactions at various developmental stages. Schools are also in the business of literacy creation, and so health literacy can be seen as a good fit, especially if schools see literacy not in terms of a skill to be achieved, but in terms of what that skill enables us to do. Health literacy, as a part of HPE, then, could be seen as sharing the goals of the education system and schools in producing autonomous and self-empowered citizens. So, from a policy level, health literacy would seem to be a beneficial part of the HPE curriculum. Benefits for students. Health literacy studies also hold many benefits for students, both on a personal and a social level. Nutbeam regards health literacy as a personal asset that empowers individuals to act confidently to achieve and maintain good health outcomes. Sound, critical level health literacy allows students to make sense of the many varied and often conflicting messages they are exposed to choose the best between them, and to act to advocate for their own and others' health. Critical health literacy education has the benefit of equipping students with lifelong, life-enhancing skills. Limitations and challenges of implementing health-based literacy in schools-based HPE. Limitations of the implementation of health literacy into current HPE in schools lie mainly in the theoretical divide between health and education, and in the gap between policy and practice within education. The intersection of health and education sectors is one that appears difficult to negotiate, with some education leaders failing to grasp the details and significance of the health theories, and health theorists lacking understanding of the realities and complexities of schooling. This reflects the difficulty teachers face when a program designed by health professionals is adopted into education without the required discourse reframing. Within education, health literacy in HPE faces the challenges of being held as valid and valuable in an already crowded curriculum, of finding a synergy and cohesion with the more physical and grounded elements of HPE, and of addressing the lack of training and professional development for teachers required to deliver the content in financially and time-restricted environments. Health literacy is predicated upon the assumption of a sound basic level of general literacy. Limitations for students. Health literacy as a rich component of HPE will also be difficult to implement at lower primary school levels and in areas of poor general literacy performance, because it is predicated upon the assumption of sound basic levels of general literacy. This may mean that some of those who stand to benefit most, for instance low socioeconomic students with poor potential school outcomes, may be unable to take full advantage due to their literacy issues. There is much more that could be said in regard to both the benefits and limitations of health literacy in Australian HPE. Its potential to empower students for future health and social change make it a valuable part of the curriculum, and the critical skills of health literacy teachers have the potential to engender social change and greater equality in both health and education in the future. Careful negotiations in the merge of health and education at policy and practice levels are needed, as well as a commitment to funding, training, professional development and pedagogical development of the concept. It is in the interests of both education and health, as well as the current and future populations, that the negotiations succeed. create a healthier and more just world for every student. References. Image credits.